happy pre-Friday. I'm Cindy Neely, and it's time for The Shortcut. Coming up on tonight's show, some women with a common type of early-stage breast cancer may be able to skip chemotherapy completely. New research shows that it's possible for certain patients to be treated with hormone-blocking therapies only, even if their cancer has spread to some of their lymph nodes. Here to talk about what this means for patients and the test women need to ask for is Dr. Deepa Halaharvi, a board-certified breast cancer surgeon who's also a breast cancer survivor. Hi, Dr. Halaharvi.
Hi, thank you for having me here today.
Thank you for joining us. So jumping right into it, what is early stage breast cancer and what does it mean for it to have spread to lymph nodes?
Yeah, so the early stage breast cancer is defined as stage 1, stage 2 breast cancer. And if the cancer goes from breast to the lymph nodes, that can happen, and it's still considered early stage, but it can happen in about 25% of the time. And the typical treatment for this has been chemotherapy in the past. So
tell us about your breast cancer experience and how has it impacted your care for your patients?
Yeah, thank you so much for asking that. I was diagnosed 8 months after I started working as a breast surgeon. And, my dad always said, whatever you do, you have to be great at it. So I really, truly feel that this was a blessing for me to be able to going through that diagnosis. And when I was diagnosed, I, went through all those emotions and feelings that my patients go through when they get told that you have breast cancer. And it did help me in finding out that I did not need chemotherapy, and I do take an anti-estrogen medication that decreases the risk of cancer coming back. So I'm very privileged, and I am so honored that my patients allow me to take care of them, and they allow me to take care of them at the worst time of their life when they get told they have cancer to now a survivor and a thriver. And I really help. I just very grateful to play that role in their life. So.
And what is one key piece of advice that you give to your patients when they are facing a treatment decision?
Yeah, the one piece of advice I would tell people is, empower yourself, be your own advocate, ask your doctor, is this test right for me? Or if there's any other treatment options, and just be your own advocate. And, us physicians will love to hear, patients coming in with questions and asking questions.
Great advice and information. Thank you so much, Dr. Halaharvi, for joining us on The Shortcut. For more information, you can visit mybreastcancertreatment.org. That's all the time that we have for tonight's show. I'm Cindy Neely, and I'll catch you tomorrow on The Shortcut.